When booking the teeth whitening treatment, ask your client to clean their teeth prior to arriving at their appointment. Have a consultation with your client prior to their treatment. Ensure that they have the right expectations and also that they're eligible for a teeth whitening treatment. Any previously used whitening treatments can reduce the amount of results that your client is going to achieve. Ask them if they've used whitening strips at home, whitening toothpaste, or even if they've had a professional in-chair treatment in the last 12 months, as all of these things can reduce the results that they may achieve. Do not have a teeth whitening treatment if you suffer from any dental condition. If you're unsure, make sure you consult your dentist prior to the treatment. Do not have a teeth whitening treatment if you have exposed nerves, cavities, or gum disease. Teeth whitening is only suitable for people over the age of 16. Teeth whitening is not suitable for pregnant women and is not recommended when breastfeeding. Have your client read and sign the client consent form prior to their treatment. Work with your client to select their current teeth shade, using the darkest tooth and using a well-lit area. Present your client with their teeth whitening kit. It is important during the whole procedure that you do not touch your client or their mouth. As you are not a qualified dentist, you are not entitled to do this. Demonstrate to your client how to use the contents of their kit. Have your client put on the bib, matte absorbent side up. Demonstrate to your client how to insert the cheek retractor using your demo model. Remembering to explain that the larger flanges go to the inside of the mouth. Have your client use the oral brush up to dry their teeth. This will create a clean, dry surface for the gel application. Taking the gel pen from the kit, you will now demonstrate how your client can operate it. Twist the gel pen until a small ball of gel appears at the tip of the brush. Explain to your client in detail how the gel should be applied. Your client should apply the gel to one tooth at a time, ensuring a thin, even coating. It is important that your client keeps the gel away from the soft tissue of their gums. When your client is finished, have a look. Check the gel is evenly and properly coating the teeth with no gel on the gums. If any gel is present, simply remove it with a cotton tip. Hand your client their protective eyewear and ensure that they are wearing their red safety glasses during the entire treatment, anytime the LED lamp is in use. Recline your client and set the timer for 20 minutes. Place the LED lamp directly in front of your client's teeth, around 3 centimeters away. It's important to get your client to let you know if they experience any pain or excess sensitivity during the treatment. If so, discontinue the treatment immediately and have your client completely rinse the gel from their teeth and mouth. Your client should contact their dentist immediately if they experience any pain or sensitivity, either during or within days after the treatment. When the 20 minutes is up, turn off the LED lamp and move it away from your client. Have your client rinse and remove all the gel from their teeth. Repeat the treatment process for another 20-minute session. Vitamin E is provided for irritated gums and dry lips after the treatment. Simply snap at the red line and allow the flow to go into the head of the vitamin E swab. Work with your client again using the teeth shade guide to find their new shade. Remember to use the same well-lit area you used to find their original teeth shade. Now let your client admire their new brighter, whiter smile. Before your client leaves, it's important that you explain to them what foods to avoid for the next 24 hours after their treatment. Your client should avoid coffee, tea, red wine, curries, cola, basically any coloured foods that would stain a white shirt. Don't forget to tell your client how great their new smile looks.